I'm Sarah Brunsberg. I'm a community health education major, and I went to Uganda this summer for my field experience.
Hi, I'm Anna Bartels. I'm a maternal and child major within the School of Public Health, and I went to Uganda this summer for my field experience. One of the biggest projects that we worked on was, it's called the Knowledge Practice Coverage Survey. And so we went out into some really rural areas and interviewed 300 women about their knowledge of family planning services, if they were covered by those services, and then if they're actually using different methods of family planning. That was my favorite part of the summer. It entailed a lot of hiking through the bush, seeing some wildlife, and really being welcomed by some of the most fascinating individuals there.
We each had individual projects that we worked on as well. I helped create an information technology curriculum for the Ugandan staff, and also we both were able to teach a few curriculums to our staff. Anna taught a photography class, and I taught an Excel class and a Word class. Another project that I worked on that was really awesome was researching the birth registration system. We were in Zimbabwe, which is a southern central district of Uganda. It has the highest HIV infection rate in the country and a really, really high fertility rate as well. So one of the things we wanted to do was kind of study to see if children were being registered at birth, because they need that registration for a lot of different things, registering for school, taking exams, getting Social Security, and sometimes, in some cases, getting antiretroviral drugs for AIDS treatment. And we found that there actually was no system at all in place for birth registration, so we made some recommendations vaguely about how they could begin to implement a system in the district. One of the things that was really interesting about being in Uganda is you're an outsider, and for me it was really the first time in my life that I was an outsider and kind of looking in on another culture, and I can't imagine being in another culture or being the outsider or the minority and being discriminated against, because it was difficult enough being an outsider and being welcomed. We were actually living in the office we worked in. We just had one room there. So that was challenging in and of itself, just living, like waking up in the morning and brushing your teeth and there would already be coworkers there. I was lucky that Anna was already there before I got there, so she taught me how to bucket bathe, and I don't know, we didn't wash our hair very much because it was really difficult to wash your hair. It was definitely an adjustment, but I think we handled it well. Yeah. I think we both took a lot away from this experience. It's the things that you take for granted here, you realize quickly how quickly they are. Things like electricity, how important they are, and I'm sure Anna has lots of other things to say. Yeah, I think, well, before I went, I always wanted to go abroad and work, and I've traveled a lot and spent time studying abroad. This is my first time actually working abroad, and so I think some of the challenges that I faced will make me think in a lot more detail about the kind of organizations I want to work with, the areas of the world I want to work in and that I'm comfortable working in by myself. Just kind of on a side note, it was really fascinating being there with Sarah because it was her first time abroad, and I learned so much just traveling with her because she asked these fantastically amazing questions that I just don't think to ask, I guess, or maybe that I was afraid to. She was really courageous in how she went out there and saw the country, so it helped me kind of see it through a new lens.